Thank you guys for having us and inviting us on. We really appreciate the time to be here and to go over some things about Medicare. A lot of people ask, how did I get into this business? Let's face it, nobody goes to career day in high school and says, when I grow up, I want to be an insurance agent. We all kind of stumble into this business. For me, I don't think you'll ever find an agent that's going to understand insurance better from your side of the table as an insurance owner than me. 1984, I got diagnosed with a condition. They gave me 3.5 years to live, so that's why they call it practicing medicine. They never get that right. So I'm still here. But 52 hospital stays and 23 surgeries later, still going. I decided my new mascot. You remember growing up, we used to have those little clown balloons where you'd punch in, it would come back up. That's my new mascot. So you just knock me down, I just come right back up. But what that has given me is an appreciation for how insurance works and where insurance bites you when you actually go to use it, and what to look out for. And that gives me a different perspective on some things. And so I believe that when you talk to Sydney and I, we have a perspective about insurance that you don't find from most agents.
Well, hello, this is Don,
And this is Gina with Focused Healthy Family.
and this is our podcast today is podcast number 188. And today we are talking about Medicare, and we are joined by Sydney Hartnell and Sarah. Oh boy, this is going to be, I'm going to say Sal and Marafiati. See, he just gave me
Marafioti,
this.
Really well.
Just gave me this right before the thing, so I didn't get a chance to practice on that part. But Sydney Hartnell is an independent insurance agent. She understands how essential insurance is our daily lives, as well as the challenges it can bring. She is also passionate about helping people navigate it. Trust is what is the key when it comes to your insurance agent, and she is committed to being someone whose client can rely on knowledge and genuine support. And so welcome, guys. We really appreciate you being here. And I love your story, Sal, and I know you're not four, so you've made it a long way with that. With that, so we're talking about Medicare, and I know you guys have a little bit of a slideshow that we can watch, and I think that's going to be really good because it's something that I've gotten into it now. I'm 67. I had to have it for 2 years, and I actually kind of like it. It's been a good thing for me. So I hope that others can learn from your slides and learn how that is a good program. So anyway.
Well, I'm a firm believer in the mug. That's all I can tell you right there. Nobody does it better than me.
Okay.
I'll tell you, we did a presentation at a large church, and I'll tell you this: people always ask, "Well, what makes you different than others?" And I say, nobody explains Medicare better than I do. We did a presentation to a large church. We had 36 widowed women at the meeting, average age 70 to 85. We had three little old ladies came up to us after, as sweet as can be, and they said, "We have been on Medicare for over 7 years. That is the first time we've understood how it works." Okay.
Wow.
I understand how complicated it can be. One of the things we like to start off is, to warn people about all those calls you're getting, right? We know they just keep coming. Every single one of those calls are illegal. So what you need to know up front is whoever is calling you without your permission, they've already broken the law to get to you. So that tells you everything you need to know about them. They're going to try and trick you into giving you your Medicare number. Don't ever, 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 ever give that Medicare out number or Medicare number out. If if we have somebody's birth date, name, and Medicare ID number, we can switch their Medicare plan. And so a lot of times when you get these calls from these call centers and they tell you about these wonderful programs and they say, "Hey, do you want to see if you qualify for this money for your rent, utilities, and all this other kind of stuff?" And you go, "Yeah, that sounds great." They go, "What's your Medicare ID number?" Right there, that's a flag. You do not need to give out your Medicare ID number to know if you qualify for these programs. There's only two ways to qualify for those programs. One, you have to be on Medicaid and Medicare both, or you have to qualify for a chronic special needs plan with something like heart disease, cardiovascular issues, or diabetes. So, in order for me to know whether or not you qualify for those, all I had to do was ask you, do you have Medicaid? Yes or no? And do you have any of these conditions? Yes or no? And you'll notice I did not need your Medicare ID number to get those answers.
And you really don't need the ID number until you're enrolling in a plan during the annual enrollment period, open enrollment period. So it's something to be very wary about.
Well, we also have to, I think we talked about this last time, was
Mhm.
watch the commercials on TV too, because I see a lot of, well, you got to sign up for this $900 this and all these different things. And are those considered illegal too? Would you consider?
They're not illegal. They're not telling you the whole story. Remember, their goal of that commercial is not to give you information. Their goal in that commercial is to get you curious enough to call.
They want you to
Yeah.
call so then they
Okay.
can go through the process and potentially enroll you in something else, right? Make a sale.
Mm.
You are always best to talk to an independent agent,
Mhm.
not somebody who works for one company. I always say, if you go to the Ford dealer and you ask them what's the best car to buy, it's never going to be a Chevy. Okay. So it's always a Ford. So if you go to somebody who works for Blue Cross or who works for Humana or who works for United, it's always going to be that company. If you
Yeah,
work for
yeah,
somebody who's a true independent like Sydney and I, we're going to show you all of your options, and
Mhm.
then we're going to help you decide um,
Based on your needs.
what's going on there. So,
Mhm.
what's that game show where they have the torch and they vote people off the island? Right? We literally have a spreadsheet of all the different plans, and we just keep voting them off the islands based on your answers to questions until it gets down to just two or three players. And then we compare those side by side to see which one gives you the best of what you're looking for.
Makes sense.
That's how it should be done.
And really, we give all of the knowledge we can beforehand. So that's why we do the Medicare overview, because it's hard to understand those plans and understand really what your needs are with those plans without the knowledge first off, right?
yeah.
Mhm.
That's one of our biggest focuses is whenever we meet with the client, no matter what, even if we've known them for years, we give them a packet and it has a lot of what we're going to show you today with the slideshow.
Mhm.
And go through it. We do a refresh. We make sure they understand everything. That way, when they're getting into the plans, they really know what they're doing.
Yeah, yeah.
This slideshow is actually a PowerPoint of a PDF packet that we use.
Mhm.
And
Okay.
when I started, I've been doing this since 2004. So I was five. So, but when we started, this packet was a 5-page packet. And what's happened is every single year, I have a rule that if more than three people ask me the same question, I assume that at least 10 others had the same question and were afraid to ask. So the question and answer goes in the packet. And that's how it's developed now into about a 15-page packet where we just go through it with people and show them the ins and outs of how everything works. And we're going to show you a little bit about that right now.
Yeah, that
Sure.
sounds good.
Sounds good.
Let's take it on.
Alrighty. So, Medicare deep dive, Medicare costs at a glance. First thing that we want to talk about is the enrollment periods. So, 2 days away, October 15th to December 7th is the annual enrollment. You should look at your plan, look at the changes in the numbers, decide really what your needs are. If there's any changes with your doctors, you may need to switch to another plan. That's when you can do that. Effective date is January 1st.
So by now, everybody who's on Medicare that has either an Advantage plan or you're on a Medicare supplement and you have a standalone drug plan, in September, you got something we refer to as the ANOC letter, ANOC, the Annual Notice of Change.
Mhm.
And it is literally a document that's split right down the middle. It shows you this year's plan on one side and how it looks next year on the other so that you can see the changes in your plan that you're currently on. Of course, that doesn't tell you what other new plans might be available, but you should always have that letter by the end of September from your carrier. If you're on a supplement, you get a letter from Medicare that shows your expense uses. But there is no annual enrollment for supplements. It's just for Advantage plans and drug plans.
Yes, and so it's important to look at it, especially with Advantage plans, and be aware of those changes. As we age, a lot of things change. A lot of health complications can come up, even new medications. So it's really important to be diligent about that. So benefit period, Sal, you want to take that one away?
So here's one of the biggest things that for somebody who's on original Medicare. So if you ever hear the term original Medicare, that means you're using your red, white, and blue card. You're not on an Advantage plan. So that's the phrase, original Medicare. The biggest surprise most people get with original Medicare is when they find out Medicare doesn't work in 1 year increments like every other insurance plan you've ever had before. It works in 60-day benefit periods. And that can come to bite you because, for instance, if you go in the hospital, your first 60 days is covered by a single copay of $1,600 and change, right? But if you have a second hospital and there's more than 60 days in between, you have to pay that again. Or if you're in the hospital longer than 60 days, you have additional charges. So 60-day benefit periods becomes very important. It's one of the most common ways when I get calls from people that aren't my clients and they go, I don't understand what just happened. And I'm like, you got bit by the 60-day benefit bug. And
it's
then we have to
frustrating when you
explain it.
don't know. Yeah.
Right.
Mhm.
Yeah.
So if there's, and that's also for skilled nursing facility, which you and I would call rehab. So when you see SNF or skilled nursing facility, don't think nursing home, think rehab. Okay. You have a surgery, come out of the hospital, go to rehab. You have a stroke, go to the hospital, go to rehab. Right. So that's skilled nursing, and Medicare Part A pays for that, and it follows the 60-day benefit rule as well.
And so, yeah, on Part A, that is the hospital. It's the 60-day benefit period that we talked about. It comes with that cost sharing with the hospital and with skilled nursing facilities. Home health agencies, a big confusion when it comes to that is they think that's home care, personal care, a company coming in and helping you bathe or dress or eat, right? It's not that. Think of it very similar to skilled nursing, but at home. And so that's really something to be aware of as well. And I think we talked about that a little bit last time, is that's when you should bring somebody in and have a long-term care, short-term care, or else it's out of pocket, and that can be very steep, especially for those needing 24/7 care or even full days of care, right? And also hospice. So Part B is doctor. It's the way I think about it. It's most simple way to say it is doctor, right? So outpatient services, doctor visits, and drugs administered by a doctor while you're in the facility. So not something that you're taking home and administering with yourself. It's something that somebody else is doing in a doctor's office or a facility.
The easy way to remember the difference of whether a drug is covered by B or D, I know D for drugs, but D for do it yourself. Okay. So if the doctor hands you prescriptions and you take it home and do it yourself, it's covered by D. If you go to the facility, get an infusion drug, Remicade, Entyvio, all those different things that people are getting, chemo, right? Those are all done at a facility. Allergy shots, a lot of your allergy shots done in a doctor's office. Most of them covered. Your immunizations, influenza things, all that kind of stuff, all covered by you going someplace else. Those are generally covered by B as in boy. Okay, so these are those numbers I was talking to you about a minute ago. So when you go in the hospital, if you have original Medicare, not an Advantage plan, you are responsible for a $1,676 copay. Now, all of these numbers are about to change because they change every year. I keep looking every day. Healthcare, if you go to Medicare.gov and look, eventually they're going to have next year's numbers. They're supposed to have them by October 1st.
Doesn't always happen.
I've never seen it on October 1st. Okay. But so if you go in the hospital, $1,676 as long as you're an inpatient. And here's the big thing. We do a whole thing about how to be your own patient advocate because we're big on education. But one of the things I will tell you is don't get admitted in observation. When you are admitted to the hospital in observation, you haven't really been admitted to the hospital. You're an outpatient. You just happen to have a room with a bed and a TV and a phone and a nurse and meals, but you're an outpatient, which means they can charge you for every little thing they do separately. You're a la carte. Okay. 1676, if you go in there as an inpatient, you get the combo, right? It's all included. Surgeries, everything. So 1676. If you're in the hospital longer than that, you got to pay 419 a day for days 61 to 90. If you're in the hospital longer than 90 days, let's face it, you're not coming home. That's a long time. My two longest hospital stays were 43 and 45 together. I didn't cross the 90-day mark. Okay. That's a long time. I think they had one guy, they made a big deal during COVID, who crossed the 100-day mark and survived and went home. Okay.
Wow.
It was so rare it made national news. Okay. So that tells you something. If you're in the hospital longer than the 90 days, you're paying $838 a day. And you only have 60 of those days in your entire lifetime. So if you have a 100-day hospital stay, you've used up 10 of your 60 days. Okay. If you're in the hospital longer than 150 days, Medicare gives up on you. 100% of the bill is on you after that. So if
Wow.
you have original Medicare and you have a supplement, your supplement plan G, plan F will pay all of those numbers no matter how often they take and happen. And that 151 days, it'll actually take that out to 365 days. So a supplement gives you that extra coverage. Nursing home, Medicare pays for the first 20 days you're in rehab, which is why so many people have such a dramatic recovery on day 18 and 19, because they know Medicare is going to stop paying and they kick you out. Okay. But if you are in there longer than that, 21 to 100 days covered, but you have roughly a $210 per day copay. Again, your supplement pays all those. If you're on an Advantage plan, this page actually gets crumpled up and thrown away. We have a whole different schedule that your plan will follow. Okay, but here's the kicker. If you go in the hospital and you're in the hospital for 2 weeks, you pay your 1676 to get in, you're in there for 2 weeks, you come out, and 2 weeks later you do a bounce back, you're back in the hospital, you're in the same 60-day benefit period. So you don't have to pay the 1676 again. The count does pick up where it left off. So you were in there for 14 days, you come out, you come back in, it's day 15. Okay. The other thing, though, is what if you have a hospital stay, you're in there for 2 weeks, you come out, and 3 months later, you go back in for the exact same condition. Doesn't matter. You're in the new 60-day benefit period, 1676 again. Okay. Again, your supplement will pay all of that. Okay. B has a premium. Right now, the standard premium is $185. I'm not going to talk about what it's going up to because there's all sorts of rumors, and I've never once seen the rumors be right. So I will tell you this: it is likely going to be more. That much I feel confident about. Okay. And you need to know that Medicare actually looks at your tax return from 2 years ago. So for 2026 coming up, they're going to determine whether you need to pay more from your 2024 tax return. Okay. So if you're over a certain amount right now, that this year it's like 202,000 for a couple. If you made more than that, you're going to pay more for part B and D. Okay. There is one annual number Medicare recognizes. It's the Part B deductible. It's $257, which means the first time you go to do anything that happens out there under B, you pay the first $257 for the year. After that, Medicare pays 80% of the allowable amount. You pay 20% plus any excess. Excess is a fun thing. I'm not sure if you knew this, but anybody who accepts Medicare is actually allowed to charge 15% above whatever Medicare says. So if they say, Dr. Sidney, we pay $100 for that service, Sidney can say, I'm pretty proud of myself, I'm going to charge $115, right? So Medicare is always going to pay off of their number. So they're going to pay the 20% of the $100. You're going to pay the 20%, or they're going to pay 80%. You're going to pay the 20% plus all of the excess, which if it's $100, no big deal. But if that was a $5,000 service, you just paid a $750 excess fee. Okay. Now,
Sal, can I ask you a question?
sure.
Is it on something like that? Can you negotiate with them?
You can just about everything in life is negotiable. Um, the success rate will vary.
Yeah.
I will tell you my experience. The more specialized the ist, the less they're going to negotiate, and the more likely they're going to charge the full 15%. By which I mean your dermatologist, probably not. Your cardiologist and your neurologist, count on it.
Um,
Okay. Now, again, if you have a Medicare supplement with original Medicare, that supplement's going to pay that excess so long as you're on plan F or G. If you're on an Advantage plan, you don't need to worry about that because your plan's probably an HMO or even a PPO where they're not going to have an excess fee, right? An HMO, they've already agreed to the fees in advance.
Okay.
We talked about this already, not need to beat that again, but they're going to look at your tax return from 2 years ago to decide based off of your modified adjusted gross income. People always argue, is it my adjusted gross or my modified adjusted gross? They're always going to go with the wise man. All right. They're going to go with the magi. And that's how they're going to determine what income they're using to decide whether you need to pay what's called an IRMA, an income related monthly adjustment amount, or as I call it, a penalty for doing well.
So there are 3 ways to tackle a lot of those costs that Medicare doesn't pay for. And the first one would be out of your pocket, which for most of us is not a real option, right? It's going to drain your savings, drain all of your funds. And in this world we are in now, groceries already drain our funds, right?
So before we talk about that, I do want to say one thing. The part about Medicare Part B covering the 80%, the thing to know is without a supplement, just having original Medicare, there is no cap to that number. So for instance, chemo, radiation and chemo is covered under Part B. If you have original Medicare, your red, white, and blue card, and no supplement at all, you're responsible for 20% of that entire bill with no cap. So you do have to do something because you don't want to have to pay that out of pocket. So your real two choices come down to here, what Sydney will cover.
Yes, and that's why I did say that's typically not a real option. First thought, and then when you look deeper into it, nobody wants to pay that amount. We want to cap it. We want to have support with those prices. And so the 2 options really are supplement plan, which is a Medigap policy with the standalone Part D, which if you see PDP, that's what that is. Or sign up for a Medicare Advantage plan with a drug plan as well. We also have MA only plans, which is without a drug plan.
So your MA plans are designed mostly for your veterans. You have a veteran who's got VA coverage. They get all of their prescriptions through the VA. There's no need for them to have a drug plan. And you may talk to them and they're 70 years old. They've never had a drug plan coverage. If you put them in a Medicare Advantage prescription drug plan, they're going to have a penalty that's permanent for those years they didn't have it. It never goes away. So we'll put them on a Medicare Advantage only that only has the medical coverage, and then they don't need to worry about the drug coverage.
And I will say that is not something that is posted at the VA. That's not something that I've seen in the veteran spaces I've been in talked about. And so there are MA only plans that do have benefits for those veterans, and a lot of them are those plans with that in mind, right? They want to be able to support veterans. But getting into the Medigaps, Medicare supplements, they work with your red, white, and blue card. And so the way I have explained it, even to my family who's gone on Medicare, is this explanation is great, but when you think about a supplement, you look at the numbers that we just looked at, and they're supplementing it. They're not taking it away. They're not taking advantage of it like an Advantage plan would, right? And so it's like a horse and buggy. It's a very good example. Wherever your Medicare card works, wherever hospital, doctor's office takes A and B, your Medicare supplement plan works and picks up most or all of the amounts left by original Medicare. And so looking at those numbers and thinking back on that from our previous slide, that's what it does. And there's a lot of perks in that. Of course, it comes with a premium compared to some Advantage plans. Some of the Advantage plans are $0 premiums, never free, but you would have a $0 premium for some of those.
The reason we can't say it's free is you always have to pay that Part B premium. So to own an Advantage plan, you have to be paying the Part B premium. So you can't say it's free. It's just zero cost, meaning there's no additional cost to own a lot of the Advantage plans.
Right.
Mhm.
Yes.
Oh,
And so,
we ran into a lot of people that don't really understand what's there for the veterans. We ran into a couple different times where people didn't realize some of the benefits that has. So it does have a lot for veterans with it.
The VA itself will admit that they do a horrible job of
Mm,
explaining to veterans what's
Mhm.
available. If you ever get a chance, I'll put a quick plug in for them. There's a group in town called Veterans Bridge, and if you ever get a chance to maybe even have them on,
mhm,
their whole existence, their whole reason for
Mhm.
existing is to be exactly what their name says. They take veterans and they bridge them to the different things that are available to them that they probably even know that's there, but they have no idea how to get to it.
Mhm.
Okay. And so Veterans Bridge is a really good, and they're here in Charlotte, and they help with people with a lot of that.
yeah,
Uh,
Good to
that
know.
sounds good.
So this is an overall chart we're not going to go into. This
Oh
is all
my.
the plans
Mhm.
that are available in the Medicare supplements or Medigaps. You'll see F, G, and N are the three most common. F sort of went away. Okay. It's
For
a
some.
grandfathered plan. You have to have turned 65 prior to January 1st, 2020. If you turned 65 before that, and maybe you've been working and now you're going on Medicare for the first time, you can still get F. I wouldn't do it. The only difference between F and G is F pays the Part B deductible, that 257 we talked about, and G does not, nor does N. The difference in premium between F and G is generally speaking about $300 to $350 a year. So you're spending $300 to get rid of a $257 deductible. I've never been the best at math, but that seems like horrible math. Okay.
Yeah,
How much
yeah.
savings?
No. N is the one I caution people about. N, you'll get a lot of agents that will find you on a supplement and go, "Oh my gosh, I can't believe your agent didn't tell you you could have had N. You could have saved $25 a month." Yes, but N does not pay the excess. And after you've paid your $257 deductible, N will still charge you copays to go to the doctor. Okay. So again, I think we're all old enough to know that when Peter hands you money, when you
Mhm.
turn around, Paul's going to have a bucket. Okay. The question is, if I get the money from Peter because I bought N instead of G, when I turn around, how much am I going to have to put in the bucket? My experience is probably more than what you saved.
Well,
Okay.
and you mentioned, Sal, and going to an independent to understand this, because if I looked at this and I tried to understand all these different letters, it would be my eyes would cross probably. So
Right.
it's
It
good to
feels
have.
like a maze.
Yeah, ours do too. We just have to do exercises every day to just uncross them so we don't look weird on camera.
And something else to note as well is you have a guaranteed issue period when it comes to a Medicare supplement for 6 months when you turn 65. And so it's important to really know all of your options
Mhm,
and make a knowledgeable choice because
Mhm.
it is not in a way permanent, but it is
So some
somewhat.
choices are permanent, and if you
mhm,
Yeah.
make the wrong one by mistake or from lack of information, 6 months from the day you get Part B, doesn't matter what age you get it, because some people delay B
They could get
because
B
they're
at
working,
67 or
right?
right.
They come off their group insurance, they get B. You have 6 months to get a Medicare supplement, any company, any letter, not a single health question. 6 months and 1 day, there's 2 pages of health questions.
And they're tough. They're tough. And a lot of people in our experience have not been able to qualify to be able to
mhm,
switch to another supplement, right? And that's a big deal for some people. And a lot of times with those rate increases, also as we age, you're getting into your 90s, your supplement might cost you a lot,
mhm.
right? And that's when we will go into an advantage plan and show the options. And I'll actually switch to that now. Because that can really save money, especially when you're in your 90s. A lot of times later in life or near the end of life, you do need to start paying for having personal care or needing more services that you didn't need when you had the supplement at 70 or 80 even. So if you want to take this away.
Okay. So Advantage plans, those are the commercials you're seeing. We talked about that earlier. All those commercials, all of those illegal telephone calls that you're getting, and all the junk mail that's been piling up. There, 95% of that is Advantage plans. Okay. Now there's an advantage to an Advantage plan. That's why they called it an Advantage plan. Okay. There is
Okay.
truth to that. It is a different way to do Medicare. So when you look at it, and we're going to get to a little left and right side, but when you look at it, you're either going to do original Medicare, a horse and buggy, right? You're going to do original Medicare with a supplement that follows along, or you're going to go, I can't afford that extra $120, $150 a month. I'm going to do an Advantage plan with a zero premium and save that money. Plus, most of those plans offer additional benefits like dental, vision, home delivered meals after hospital stays, free gym memberships like Silver Sneakers, Renew Active, Silver and Fit. There's a whole bunch of them. They almost all give you some kind of over the counter allowance per quarter that you can spend on vitamins and cold medicines and adult diapers and all that kind of stuff, right? So you're getting all these extra things, and it's all included. And again, most of the Advantage plans have the drug coverage built right in. What I will point out about the dental and vision, this is not dental and vision insurance. This is a dental and vision allowance. You have X amount of dollars available to you that will be allowed to be spent on those things, and always be careful about the fine print. I'm a big firm believer that the big print giveth and the fine print taketh, right? So always know most of these plans will allow you to go out of network for your dentist. Make sure you understand what the cost factor is when you go out of network.
It's always a cost.
An HMO makes you stay in network. A PPO will allow you to go out of network, and a lot of people like that feature. But every time you go out of network on a PPO or a POS, which is point of service for a dental, every time you go out of network, you're going to get spanked. Now, sometimes it's going to be a little slap on the wrist. For instance, if you went to your primary care doctor and he was in network, it was zero cost. Out of network, it was a $20 or $30 copay slap on the wrist, right? Your max out of pocket on an Advantage plan with a PPO, maybe in network it's $5,000, but if you go out of network, it's $10,000. That's a 2x4 to the head. Okay, so be aware if you're doing something that has a PPO and you're buying it for that reason, make sure you understand what's going to happen when you actually do it. Okay. And this is what we've already said. Advantage plans are not just another way to supplement Medicare. It's in exchange of. You're either going to use your red, white, and blue card with a supplement Medigap policy, or you're going to put that red, white, and blue card in a drawer and use your Advantage plan for everything. It's going to cover everything, your A and B and your D and all that kind of stuff.
And somebody actually, I think, asked you, I might have been there, but they said, oh, well, a Medicare supplement is like the group plan I had, or like the individual under 65 marketplace plan. And I remember you told me, you laughed and you were like, well, no, actually, Advantage plan is a little bit closer to that. And so the way we've explained it, you will have that premium, that deductible, the max out of pocket. It's very similar to under 65, but it is different. And so people going on Medicare, it is overwhelming with the differences.
Here's a big difference between an Advantage plan and say the group health plan that you have through your job, or a marketplace Obamacare plan. Okay. So a couple of years ago, I had a 20-day hospital stay, 2 surgeries while I was in there. Okay. My hospital bill, just the facility, $178,000. Okay. Now, on traditional health insurance, I have to pay my deductible, and then I pay a percentage of the rest of the bill. So I don't care what your max out of pocket is, you've hit it, right? On an Advantage plan, hospital stays are flat copays. So you pay roughly $300 a day for roughly up to 6 days. It varies by plan. But that means if you're in the hospital for two days, you paid $600. If you're in the hospital for 20 days and had 2 surgeries, you paid $300 times 6, and you're done with that bill. Okay, so very different. Very few Advantage plans have a deductible for medical services. They might for prescription, but not for medical services, unlike the plan you're used to at work. So actually, the stats are that less than 3% of the population on an Advantage plan ever hits the max out of pocket. Okay. When they do, it's generally cancer, radiation, and chemo,
Mhm.
expensive Part B drugs, a long stay in a skilled nursing facility. Those are the top three. Um, prosthetics and dialysis, of course, are going to be up there too because you're paying 20%, so you're going to hit your max out of pocket. All right, so let's just look at pros and cons, right? I mean, this is this is no holds barred. This is no dog in the fight. Sorry, PETA, but this is just flat out facts. Okay.
Mhm.
On the left hand side is what I call the government blend. You're using your government original Medicare and you've bought a private supplement,
It's a
right?
horse and buggy.
Horse and buggy. On the right, you've done an advantage plan. Okay. By far, the number one reason you do a supplement is that it's accepted by everybody who takes Medicare.
Mhm.
So if you wake up, you've got some kind of condition, you wake up one day and there's a doctor in Boston or New York or Dallas, Texas or Podunk, Mississippi, and they've got the newest, greatest, latest way to deal with your condition,
Mhm.
you're not wondering if they're in your network. If they take Medicare, you can go anywhere in the country. Okay. So that's the number one thing, is that it's accepted by everybody and it is the most comprehensive coverage you've ever had. I want you to hear this and understand this. In a couple of years ago, when the Part B deductible was $198 that year, I had a lady, August 1st, she went on Medicare, put her on a supplement plan G. The 15th of that same month, she had her hip replaced. It was a little complicated. She spent several days in the hospital. She spent over a week and a half in rehab, and she owed $198.
Mhm.
Okay. That is the single most comprehensive coverage you've ever had in your life. So, what's the
Mhm.
negative? The real negative is the cost. Not everybody can afford my 185 plus an additional 120, 130, 140 every month. Okay. So, the cost really, if you can afford it, you should do a supplement. I
Mhm.
mean, it is most comprehensive. But you also do need a separate dental and vision plan if you want that, and you're going to need prescription coverage. On the other side, you have the Advantage plan. The number one reason people do an Advantage plan. It's inexpensive to own. Zero cost on a lot of the plans, even the ones that have premium, they're under $50 a month.
Right. And usually those come with more benefits when they do have premium.
Okay. So now you're doing this Advantage plan. Okay. Your dental is included, your vision's included, your prescription's included. You get these
Mhm.
gym memberships, you get these over the counter benefits. Oh man, this is all sounding wonderful, Sal. This is great. Yeah, that's Peter. Let's talk about Paul and his little bucket. Okay. So the con is it's going to be more expensive to use. The expression I've come up with is a supplement is always more expensive to own and cheaper to use.
Mhm.
An Advantage plan is always cheaper to own with the potential that it's going to be more expensive when you use it. Okay.
Sure.
So you got to trade that off, right? I listen, I always default to the great philosopher Clint Eastwood. Do you feel lucky? Right? Right? How do you feel about that risk? Listen, I tell people your health is a lot like the stock market. Past performance, no guarantee of future results. Nobody
Mhm.
knows that better than me. I went to bed feeling wonderfully healthy, working out, bench pressing my weight and a half, feeling great. Woke up in the middle of the night sick, and I haven't been better since. And that was 1984. So I know better than anybody. It can turn on a dime, and there are
Mhm.
agents out there who will feed off of that fear, and that's not what we should be doing. Let's look at the realistics of it.
Right.
How
Yes.
has your health been? How many times in the last 5 years have you hit the deductible or max out of pocket of your current health plan? Is your
Mhm.
health getting better? Is it staying steady? Or are we on a downward trajectory?
And
Right?
something to add to that, something I will do when somebody's first going on Medicare, they're saying, "Oh, well, I don't take any medications. I exercise. I don't really go to the doctor. I never hit this with my plan, right? Everything that we're talking about." But I still will say, well, you're going into your 60s and then it'll be all of a sudden your 80s. Right. So it's really something to think about is what will suit me now, but what realistically can happen because you don't know. Like Sal said, you really don't know. And so it's really important to think about that when going on Medicare and making those decisions of which plan you're going to go with, right?
And don't forget, you get an annual option to move from the left side to the right side.
Mhm.
So what I always tell people is if we get to this point of a presentation with somebody and they're like, I'm not sure, I'm on the fence, I say, do the side on the left because you only have 6 months to be able to do that. And
Mhm.
next year, you can always move from a supplement to an advantage plan during the annual enrollment period without any questions. And oddly enough, too, if you're on a supplement and you decide to go to an advantage plan, you have what I call the 12-month Medicare mulligan. Okay. You have 12 months to go, oh, this was a horrible idea. I want to go
Mhm.
back to my supplement. And you can go back to the plan you had, and they have to take you. 12 months in one day, you have to answer 2 pages worth of health questions to go back. Okay.
Mhm.
So when in doubt, go left on this one, and be over there with that coverage. You can always move without any health questions to an advantage plan.
Interesting. That's something that wasn't explained to us when Don went on. He's an independent agent that we worked with, but he chose the Advantage plan. So if he wants to go to traditional Medicare down the road, he's going to have to answer
Health questions.
health
Mhm.
questions.
Mhm.
Yeah, that was not
So,
explained to us.
right. So here's what I tell people. In North Carolina, you get your health license. Once you have your health license, you go get a Medicare long-term care license. That allows you to sell, as the name would imply, Medicare supplements and long-term care. So anybody with a Medicare license can sell a Medicare supplement.
Mhm.
To sell Advantage plans, there's a specific training. It's called AHIP. We have to do it every year. It's like a 6-hour training. We have to do it every single year. Plus, you have to do another hour or so training with every single carrier you're going to represent.
It's very
Okay.
thorough.
It's very thorough.
Very thorough.
Okay. So a lot of agents, we go back to that Ford dealership, right? If all I can sell is supplements, then what's the best thing for you to do? It's always going to be a supplement. When I can do both, I've known a lot of agents that once they start doing advantage plans, they are so, I mean, it's just everybody should buy an advantage plan,
Mhm.
right? And I always tell people anybody who says everybody is wrong.
Mhm.
Okay, because you're not everybody. I don't have any dough and I don't have a cookie cutter. Everybody's different. I will walk into a house with a husband and wife, and the husband or wife does a supplement, and the other spouse does an advantage plan.
Mhm.
I go to a house where I've got both of them do an advantage plan, and one of them does United Healthcare and one of them does Blue Cross Blue Shield. So the cool thing about Medicare years is for a lot of couples, it's the first time in decades that they get to make separate decisions about their coverage, right? Because they've been joined at the hip on one plan until then.
Mhm.
So
Yeah.
you don't have to do the same thing or even with the same company. So every year is a review. Right now, good gosh, we are in overtime overload. I've got 3 assistants helping me and Sydney schedule all the people that are our current clients so that we can review because we don't like to let anybody auto renew because too
Mhm.
much changes for you. You've got new prescriptions. You've got prescriptions you were taking that you're not taking. Here's one of those things where I tell you about people that don't know things when we talk to them about Medicare. You know how every drug is in a tier 1, tier 2, tier 3. Are you aware those tiers are not universal?
Hmm.
That you may be on a drug that Aetna puts in a tier 2 and Blue Cross puts in a tier 3 or vice versa.
Mhm.
Wow.
Oh,
And that is a big difference in your costs because the deductibles generally don't apply to tier 1 and 2, right? Some plans have drug plans. Tier 3 is still a flat copay, and a lot of the plans this year have moved to a co-insurance. So it's important to not just look at your ANOC letter and see what's changing about my plan, what's changing out there, and
Mhm.
what is happening to me personally in the last year that I don't remember or really acknowledge, right? It's like sometimes, you lose some weight and somebody says to you, man, you look like you've lost a lot of weight. You don't feel like you have because you've lost it slowly and you see yourself in the mirror every day. Or unfortunately, most of the time it's the other way, right? Somebody says, oh, you look like you gained a bunch of pounds, right? And we didn't notice it because it happened slowly, right? How you cook frogs really slowly alive, right? So, I mean, the water just slowly heats up. So, So it's important for somebody to sit down with somebody like Sydney or myself and let her ask you the questions
Mhm.
that you may have not thought to ask yourself.
And that should be an every year thing because, like I mentioned earlier, those needs do change. Prescriptions come up that are needed. There's a lot that goes on as we age, and it's really important to stay up to date with that and keep up, right? Make sure you're looking at your plan, at the formularies, looking at how much it's really going to cost. I know I talked about this last time, but there's a lot of agents that they're just like doctors. They're going to skim through all of this, put you on a plan, and you're going to leave feeling confused. And so that's really not how it should be. It should be personalized. It is based on your needs, right?
Mhm.
That's why I don't like people doing this over the phone. I mean, good gosh, I mean, we're showing you slides and how hard this is to comprehend sometimes. I can't imagine a 70-year-old talking to somebody over the phone, trying to understand what their options are and
Yeah.
making a informed decision. You should
Mhm.
talk to somebody who's asking you questions. I'm a firm believer. God gave me two ears, one mouth. He did that for a really good reason, right? So most people talk more than they listen, right? And generally speaking, one of the best phrases I ever heard one time, it was on TV, it was a show, I won't say what, but they were talking and they were kind of in an argument. And he said, I need you to hear what I'm saying. I need you to listen. She said, I am listening. She said, no, you're reloading. And that's what most people are doing in a conversation, right? You're talking, then the other person's talking. You're not so much listening as so much as you're reloading with your next thing. So I
Mhm.
try and spend as much as I can listening, to asking the right questions and listening to where that goes, whether we're talking about Medicare, long-term care. We all do the marketplace, Obamacare, because it's not uncommon for us to have a husband and wife retire, one
Mhm.
63, one 65. We got to be able to help them both, right? Life insurance and annuities and all the kinds of different things that we can do to help so that we can give you a complete package and a plan. And the things we don't do, we have vetted partners that we know we can hand off. I don't do financial planning. If you want to put your money someplace where it can go backwards, I am not interested. I am
Right.
never going to have the good news, bad news conversation with a client where I get to say, bad news, you lost 100 grand. Good news, I still got paid. Not having that conversation, right? So I made a choice not to do that. I do work with annuities and things that we can work with, which I think people our age need to be more involved with. But these other things, we have partners because those are valid places. So we do our due diligence. I tell my clients, think of me as your own personal Angie's List, right?
We want
So
to be that resource.
be the
Mhm.
resource.
Mhm.
Yeah.
Listen, I know we are about at time to wrap up. I wanted to, if anybody has any questions for Sydney or myself, we'll be glad to field those. I don't know if you've had any questions come in. They can always go ahead and put up your last thing of they could always contact, um, keep going. That one, they could always contact Sydney directly. We do work together, so it's a two for one deal.
Hmm.
So even our shirts are almost the same.
Yes.
All right.
Quite coordinated.
We don't plan that. It just happens a lot.
On Mondays we wear blue.
Yeah. So, the only time she's safe is when she wears pink. I know I can't do pink. If I wear pink, I look like I've been dead for a week. Um, I'm impressed that I'm impressed by your yellow
It
shirt.
looks nice.
But
Yeah.
if I did that, people would think you had a mummy on the channel. What do they say? It's not in my wheelhouse. But listen, we really appreciate you guys having us. Let me know if there's anything else that you are questioning or running
Do
around
you
your
have any
head.
questions of your own?
Yeah. So,
Can we take off the screen, I guess?
yeah. Um, so Don signed up for a plan 2 years ago, and one thing that he added, because it's an Advantage plan, was that if he was in the hospital, it would pay $300 a day for 6 days.
Yep.
And we're very glad that we did that because a year later he's in the hospital. And it did take some paperwork filling out. So I assume that's something, I don't know how many agents talk about that, but I
Not
know
enough.
being an occupational therapist working in skilled nursing, Advantage plans, what they don't pay for, because I see that all the time.
Most of those gap plans that you're talking about, we call them advantage gap plans. You don't need it if you have a supplement because you don't have those expenses.
Mm-hmm.
But your gap policy will generally pay the hospital copay. It'll pay the skilled nursing copay. It'll have ambulance ride copay because that is a copay in your advantage plan. And you can generally put at least a $5,000 cancer rider on there. That is most plans, 5,000 is a guarantee issue number. Okay.
Mm-hmm.
So those are excellent plans. I will tell you that we actually have a software that when you purchase an Advantage plan, we can literally click a down button and it picks the plan you're on and it tailor builds that gap plan to fill the needs of that plan. That is a great tool, but I do want to point out, don't forget, you're going to have the Advantage plan for a long time, and you're going to have that gap plan for a long time, and the gap plan is fixed. So I always say buffer that a little bit because right now the average is $295 to $300 a day for 5 to 6 days. Next year, that average is going to $300 to $350 for 6 or 7 days, right? So give yourself a little padding for future inflation and changes on those plans. But those are very inexpensive. You probably pick that up for probably $30, $40 at most, depending on how much you buffered the plans. But I would say those are the three basic things you want out of that. You want it to pay your hospital stay, your skilled nursing, and that ambulance ride.
Mm-hmm. Because those things are quite expensive. Yeah, so I've been in healthcare long enough that before there were options with Medicare, but there also was not prescription drug coverage. So it's wonderful to have options, but at the same time, this is overwhelming, right? It's a whole lot of information to figure out. And I know that, I work in an independent living community that reps come in from particular Advantage plans to do presentations, but it's basically a sales pitch, right? And people don't get the full information. They don't find out, like working with an independent agent to know, because we talked both plans at length with our agent to understand the options that there are. And it's unfortunate because so many people out there that are on Medicare, this is overwhelming. This is confusing. They might have some cognitive issues already, and then they've got to figure this out.
And there's things too, like we are not transactional people. And that's one of the things I believe that sets us apart. When Sydney first started working with me a couple of years ago, she's like, this is completely different than what I've seen before. You're not order taking, you're not selling, you're not. My job, our job, educate you on how Medicare works. Educate you on what your options are. What is your exposure? Where is it? What are your options to cover that? And I always tell my clients, I'll answer any question you ever have, except for the one question you're going to ask me the most. I will not tell you what to do.
Yeah, and I'll also not tell you what we would recommend for your mom to do, or for our mom to do, right?
So they always say, well, what do you think I should do? If you're asking me that, I messed up somewhere and didn't explain.
And that's when we go back through the basics and go back through all the details to make sure that you really do have all of the knowledge that you need to make that decision.
We get to know our people. We have several 55 plus apartment places that we work with, a couple of senior centers that we work with, some independent living places. We're there twice a month. We go, we have a blast. We play Pacino. If you've ever played Pacino, and we have a version that we call high stakes Pacino. It's pretty fun.
With money.
Yeah, it was money involved, just coins. We play bingo, but I've invented a game called Zingo, and we just have a lot of fun. And so we go to the place once a month where they know we're coming just because we want to have some fun with them. And there's no sales, there's no education, but there's a lot of conversation that goes on there. And then we're back at that same place a second time that month to do an educational seminar. And we've got 16 of them now that we do on a rotating basis. How to be your own patient advocate.
Thing, right? When we are getting questions about other things, okay, let's add this to the seminar list. Let's see what we can do. We have cost saving tips, preventative services,
and protection.
Right. So how to use the cell phone or make better use of it, right? Um,
So it's just a very relationship oriented thing. I sat down one day, and a guy said to me, there's another agent, he said, I have 2,000 clients. And I looked and I said, no, you don't. And he thought, he goes, no, yeah. He's like, I got right at 2,000 clients. I said, no, you have 2,000 customers. And every year you do this and hope they renew because there's no way you're providing customer service to 2,000 people. We
Mhm.
intentionally keep our book at a manageable level. And this year it's taken me bringing on two extra assistants for us to
yes,
help
yeah.
us to schedule everything to make sure that every single one of our clients, Medicare and ACA, have time to talk to us about their plan and their options and understand it and make a good decision for themselves. And when the
Yeah.
book gets beyond that size, we bring another person in to take up the slack.
Mhm.
That it's so good to, hear that you're out there to help people and to inform them and educate them. I love that you go to places and do, fun interactions and also the educational talks for them because it's a lot of information and, having it on a regular basis, people can ask their questions. So appreciate that you do that and so grateful that you guys came on here with us today. This has been very informative. And for those who are listening to this, check out our YouTube page so you can see that presentation. But we can also share a link to where you can find out more.
You want to wrap up?
Yeah. Do you have any last things you'd like to say?
Well, we're just very appreciative of you guys having us on. Anytime, any topic you wanna let us know in advance. We'll be glad to share with your audience and give them some basic ideas of, you know, everything. Like I said, from long-term care needs to how to avoid the scams, how to stop those stupid calls from your phone. There
Yeah.
actually is a way to do it.
Yeah,
So,
And
uh,
yeah,
please, reach out with any questions, especially with enrollment periods coming up. There's a
yeah.
lot of changes, and it's important to know those.
And we'll have your information up on the website too, so they can find it from there too. So
the dates
Great.
for everybody to remember, October 15th. So what do we day after tomorrow is the first day that you can do any changes to your Advantage or drug plan. So October 15th through December 7th. That is the period. Everything takes effect January 1st. And if you're under 65, you're on the marketplace plans. That is November 1st to December 15th. That is the cutoff for a January 1st effective date. This is the last year that they are going to allow us to go from December 16th to January 15th, but that gives you a February 1st effective date. And starting next year, that second go is going to be gone.
Okay.
But thank you both so much.
Thank you. Thank you both, Sydney and Sal, for joining us here today. To all our listeners, thank you for joining us. We hope you've enjoyed this. If you have comments or questions, or if you particularly enjoyed this podcast, please give us a like, share the information. If you'd like to learn more about Don and I and how we can support you in caring for an aging loved one, please visit our website at focusedhealthyfamily.com. You can learn more about Don's EFT tapping practice and the free tapping class he does Tuesday evenings at 7 p.m. Eastern Time. You can find us on Facebook at Focused Healthy Family, Instagram, Focused Healthy Family 1, YouTube at Focused Healthy Family, where you can view this interview today and see the slideshow. Join us every Thursday when we air each podcast. We've had on a lot of different guests that we've spoken to, as well as conversations Don and I have had covering different topics. So please join us in the future. Again, thanks to Sal and Sydney. And remember, how you speak to your children and your loved ones today shapes their future and yours.